Right. I am Dr. Abbas, and today we are going to discuss another pulmonary case in medicine. So, today we are going to discuss a chest x ray that is related to a very classic finding of a disease, pulmonology disease. Basically, it is a complication of a disease. So, right, I give you 5 seconds to spot abnormality in this x ray. After this, we will discuss about the scenario. Yes. So this is an X-ray of 24-year male. This male was admitted in the hospital 2 days back, and at that time his chest X-ray was normal. Now after 2 days, he developed dyspnea, chest pain, and when we did his HB was decreased and his reticulocyte was increased. So now can you spot abnormality or can you guess diagnosis in this patient by looking his chest x-ray compared to his initial x-ray at the time of admission when his x-ray was normal, and he is having a history of sickle cell disease. So I am giving you a very important clue over here, a sickle cell disease history. So now can you spot abnormality or can you guess diagnosis in this patient with reference to that he is having a history of sickle cell disease? Right. So this patient is having acute chest syndrome. How I can come to know? Because any patient who is having a sickle cell disease and give present to you with a chest pain and hypoxia and having a decrease in HB and his reticulocyte is increasing, it's almost sure or guarantee that this patient will be having acute chest syndrome. For example, in this case, when he was this patient came to us with the leg pain, and when he was in the hospital, his only presenting complaint was that he is having a pain in his leg and his arm. But after 2 days, and at that time, his chest X-ray was normal. There was no infiltrate. Now you can see there are infiltrate over here. So this patient developed something. But after 2 days, he developed progressive dyspnea and chest pain and hypoxia. His oxygen saturation was decreasing and it was almost 88%. So you know it's acute chest syndrome, because now you can see these are the abnormality. These one, these one, and these one. These all are the infiltrates that are indicating that this patient is having an acute chest syndrome. So what is acute chest syndrome? Sickle cell, whenever there is a sickling in the red blood cell, so these sickle cell do the microocclusion in the microcirculation in the pulmonary vessels. They do the blockage that result in hypoxia, chest pain, and you know, and patient is having a progressive dyspnea. So these are the symptoms. So whenever you are in a round or in having a patient admitted in the ward and having give you a sickle cell history and now he is having a chest pain or hypoxia, you should do his chest x-ray. And whenever you see any chest x-ray infiltrate, new infiltrate, you should be keep in mind that this patient is having a acute chest syndrome, right? So this is a classic case of acute chest syndrome. And when you will see his labs, his HB will be decreasing and his reticulocyte is increasing. You should be keep in mind that this patient is having a acute chest syndrome. And the most important step is going to you are going to follow is the hydration. You will improve the patient hydration. This is your first step, right? You will give him fluid to improve his hydration. So this is a classic case of acute chest syndrome, and how the patient will present and how the infiltrate you will see on the chest x-ray as this patient, right? So this today we have discussed Acute chest syndrome. This is a classic case in a pulmonary in medicine.